All right. Good evening, everyone, and welcome to ATP Live Monday. Um, I hope you can see me and you can hear me. Welcome to ATP Live Monday. So please, whichever platform you are joining us from, help us to share the video. Share the video, share the link, and invite your friends and family to be part of this. Thank you. I'm just also going to do the same. So ATP Live Monday is a program where you get to ask any questions that you may have on the health of your children. Hopefully in the next 1 hour, we should be able to do that. So feel free to start dropping your questions on whatever questions you may have. Welcome everyone. So I'm just going to share as well, especially to our groups. So everybody can see. Okay. Good evening, everyone. Welcome to ATP Live Monday. I am Baby Sola Boyde, and a pediatrician and CEO Ask the Pediatrician Foundation. So I'm going to be here for the next 60 minutes to answer any questions that you may have about the health of your children. So feel free to start dropping your questions. Feel free to share the videos to all the groups that you can share to, or your friends and family. Everyone is welcome. We just have 1 hour to do that. This month is actually ATP 8th anniversary. So yes, it's been a while we've been doing this. So thank you so much. Thank you so much for joining us today. All right. So all right, I hope I've shared the right video. Okay, yes, I did. Okay. All right. So let me just make sure the videos are pinned in our groups, and then we can start to take questions. Instagram people, I see you. You're welcome. Welcome everyone. Okay, I need to. Okay. Just need to make sure I can pin them. Then we can get ready to start. Okay. All right, let's start dropping the questions so that we have enough time to answer them, and we don't have to struggle towards the end. So let's just start dropping the questions now. Okay, yeah, you can ask anything, Ira Hall. That's why we're here. Ask any question, but please ask questions about the health of your children. And when you're asking questions, please start with the age of the child. If you want to ask questions about weight and height, please tell us the current weight and all that, and the birth weight as well. So remember that I'm not with you. Remember that I'm not seeing your child right in front of me. So you need to make sure you put in all the necessary information that will be helpful for me to answer your questions, so that I won't have to ask you back and forth again to add more questions. That it just delays us unnecessarily. So if you put in all the necessary information straight away, then I can easily um, just give you an answer straight away. If you have questions about skin rashes and all that, it's really impossible to do that without seeing them. So for those kind of questions, I would recommend that you go to our you go to our groups, and then you drop your questions in the group with a picture of the rash or the what, or a video, whatever you want to share. That way it is easier for us to answer those questions because we have a picture in front of us. So it's better that way. So, but any other question, children health issues, you're welcome to ask, and I'll be very happy to answer them. All right, I think I'm done with most of the sharing and pinning, and I think we're good to go. All right, okay, yeah, I think we're done with all that. Okay, so let me now welcome everybody. Again, especially welcome you all to Ask the Pediatrician Facebook, Ask the Pediatricians Live Monday, sorry. And Ask Pediatrician Live is a program of Ask the Pediatricians Foundation where you can ask any questions that you have about the health of your children, and we will try and answer them in an hour. So this is ATP Live Monday. We're always there most Mondays, except it's a public holiday or another event going on. We're always here to answer your question. So feel free to post your question and I'll do my best to answer them. But if you have any question beyond the live section, you can also post your questions on Ask the Pediatricians Facebook groups. We have about 4 Facebook groups. We have Ask the Pediatrician, the proper ATP for children health issue. We have ATP family for adult health issues. We have for those who need psychological emotional support following the loss of a child. We have the ATP first time mom Facebook group as well. So you have so many places where you can post your questions. So feel free to uh, join us on any of those platforms. So uh, after the live session, but live session gives you an opportunity to just get your answer straight away live, because for the groups it may take us up to 72 hours sometimes to get back to you on your questions. So it's always easy for you to just drop your questions. I'm not sure whether Facebook can see me because I can't see anybody commenting. I can't see anybody. So if you're on Facebook and you can see me, please let me know so that I know nothing is wrong somewhere. Yeah, but okay, I can see I'm in the group, but like I'm not sure whether people are seeing it. So let me just know you're there. Copy the link though and share it. Oh no, this is the wrong one. Okay. All right. I just want to be sure the Facebook people can see my posts. Sometimes we struggle with Facebook and the shenanigans. All right. Yeah, copy link. Okay, so I think I've seen that now. Okay, so I can't see any questions yet. Am I missing out anything? All right, nobody has asked a question on Facebook, on Instagram. So feel free to ask any questions that you may have, and I'll try my best to answer them. I don't think there's any questions on you. For Instagram, you have to drop your questions as a comment in the comment section, and then we can answer them, and that's how to do it. Unfortunately, you won't be able to join my Facebook video live. All right, I hope there's nothing wrong with Facebook because I can't seem to be seeing anybody online today. Okay, yeah, they are there. All right, I can see somebody coming on live now. Okay, so I just want to be sure everybody's there. So welcome everyone. Feel free to drop your question. I think I have one question on Facebook. Somebody say my baby of 3 weeks tongue is black. That's very unusual for your baby's tongue to be black. So the first thing you can do is just get a clean cloth with water and try to what happened to my, I hope I'm on the right platform. Okay, I don't know what happened to my okay. All right, so clean the tongue with a clean cloth and water and see whether it will come off. So if that doesn't happen, you have to see a pediatrician. We just need to really know what is causing the tongue black. Then the question is, how are you feeding your baby? We recommend that you breastfeed your baby exclusively. Make sure you clean your breast as well. Make sure you clean your nipple. Some of you, when you just had the baby, they sometimes all those around your nipple, there always this blackish stuff that tends to be around that area. Make sure you wash it, scrub it with your normal sponge and wash it and clean it very well. Then you can start breastfeeding your baby. So then for your baby's tongue, you can just clean with clean clothes and water. That's all you need to do. Don't use glycerin, tomato, any of those things people recommend. Please don't use them. Just clean with clean clothes and water. But if the tongue is still black still, then you have to see a pediatrician for further evaluation. You should do that pretty urgently as well. All right. The next question, what are the things to make pap for a baby of 6 months? So making a pap is not a pediatrician kind of a question. You should know how to make pap. You can ask fellow mothers. It's a nutrition kind of a thing. How to do your pap? You can use just your maize, you soak it, you blend it, you sieve it, and all that. But it's a question you can easily Google for yourself, and I'm sure there are lots of people who do food cooking and all those kind of nutrition Facebook pages, Instagram, and all that, or website where you can learn how to do things for yourself. So things that you can learn to do for yourself is better you just do it by yourself. There's no special thing about that. It's strictly an health question. So feel free to do that. But just for you to know that when it comes to complementary feeding, it is not just pap, okay? That's just the only thing that will concern the pediatrician with your question. Your baby is not going to just be only on pap. So for that, since your baby is just going to be 6 months, I will recommend that before you even start with the pap and everything, make sure you go to our guide section. Make sure you read and watch all the videos on complementary feeding so that we don't get into these rods of pap and pap alone or pap and milk. That is not complementary feeding, okay? Complementary feeding is not just about pap. There's virtually all the food that your baby can eat, but you need to know the quantity of the texture to make and how frequently to feed at 6 months, at 8 months, at 9 months, at what really need. So make sure you have all that information first, and then you can now proceed with the rest. So, but you can make your own pap, no problem about that. But just be aware that it's not only pap. Also, just be aware that when you're introducing complementary feeds, you introduce one new food at a time because of the risks of allergies. You don't want your child to develop allergic reaction. So you don't want to, like when you're making your pap, some people will say, oh, add ginger, add all sorts of things, garlic, olives. No, don't do that. It's better to make your pap plain first for the first time. And then when your baby starts tolerating that and you know your baby is not allergic to that, then you can add one new thing at a time, so that if you had one new thing, and I would not encourage you to, when you're adding something new, to make it in plenty batch. It's better you make a small batch first, so that you will see whether your child is allergic or is going to react to that. And usually, to be honest, most of these things, like garlic, like ginger, it's not really necessary for children. They are not really gaining any calories or anything from them. So, and some of them are so spicy, and babies are not. Uh, that's not the first thing you want to start introducing to babies, spicy stuff and all that. It's going to make some of them not to like the food. So you need to be careful when you're going about. So something plain is better. It's better to make your plain pap and use either your breast milk or formula to add. Then maybe later you can try maybe 1 spoon of crayfish with the pap, or you can try even granules, that you have blended, or you can break an egg into it. That is a way to make it fortified with protein. And then you can add maybe 1 teaspoon of palm oil. You cook it all, very well on fire, and then you can give your child. That is just pap. That is not just ordinary pap. It's fortified. So the child is not just going to get carbohydrate from it. The child is going to get protein. The child is going to get fats and all that. And like we said, each of them one at a time, and avoid all those cereals that's already made in the stores that have too many things. Many people like to start with all those Tom Brown. I don't recommend you start that for your babies, because there are too many things inside, and when your child is reacting to one, you will never know which one your child is reacting to. So that is just what I will add. But for more information on complementary feeding, you can always go to Ask the Pediatricians Facebook group where you are right now. Drop and go to our guide section. We have lots of videos there that you can watch, and then you can learn how to go. I find that when people have the right information, it makes it easier for them to be able to do the complementary feeding. So I hope that's helpful. Yes. All right, Instagram. I can't see any question on Instagram. So if you have any questions, feel free to drop your questions, and I will try and answer them as well in the next 1 hour. But like I said, this program has been brought to you by Ask the Pediatricians Foundation. For this one, it's Facebook or YouTube. You can see all the details on what way you can contact us at the back or on the scrolling part of it. So feel free to contact us. I know that you can always ask your questions every day of the week, Monday to Saturdays. Apart from Sunday, you can always ask your questions. Drop your question on our Facebook, and we will try and answer them as much as possible. All right. Okay. So questions after the live session. August is our breastfeeding week. Breastfeeding week is the 1st of August to. Okay, I don't know what's happening to my Instagram. Okay, okay, I cancel my camera. Okay, sorry, it was my fault. All right, so let's go on. I have another question. I was talking about breastfeeding week. So 1st of August to the 7th of August, every year we celebrate breastfeeding week. So that will be the time for everyone to learn more about breastfeeding. Whatever questions you have on breastfeeding, feel free to join us and to ask about it. All right, the next question. Somebody say I'm having sharp pain that comes and go in my breast and armpits, and I'm a breastfeeding mother. I'm scared. I don't want it to be. I don't think it will affect my baby. Okay, so there are many reasons why you can have pain in your breast. Sometimes some of the hormones that is released produces milk that makes your breast to contract, make your uterus to contract, the oxytocin and all that. Sometimes it can give you that little bit of pain. Number two, make sure that your baby is not sucking on your nipple. Make sure your baby is well attached to the breast and not just on the nipple. And if you're having like nipple sores or pain and all that, most likely it's because your baby is biting on the nipple and not sucking, the on their real, because for those of you who have looked at our Facebook group, or they watch the breastfeeding videos, you see that there's what we call the milk sinuses or the milk bank. They are under the areola. That's where the milk is stored. So that is where the baby's gum should be, not just that projecting part that we call the nipple. So if your baby is sucking on the nipple, nothing's going to flow, and the baby will get frustrated, and then they will start to bite on the mother the more. But if you make sure that when you want to breastfeed, you make sure you push in most of the nipple and the areola, everything in the mouth of the baby, then baby can suck on the areola and the milk will flow. So that's another way to avoid nipple or breast pain. Okay, but because the breast is overlying the chest, sometimes some pains you're feeling inside your chest may also appear as if they are coming from your breast, but they actually chest pain. So in that case, you have to see your doctors, make sure they check you properly. It is not going, there's nothing that's going to affect the baby in any of this scenario. It's about you making sure that you get yourself checked out and all that. So, but if it is, like I said, most of the time it's not unusual to have a little bit of breast pain, like suddenly because of the hormone effect causing contraction. But if you're having pain and it's radiating down your arm and all that, especially your left arm, then we'll be worried about something that has to do with the heart, and that is why you have to see a doctor for proper evaluation. All right, Instagram people seem not to be asking questions today. I guess everybody is happy, it's fine. But if you have your question, feel free to drop them as comments or in the question box and we'll answer them. All right, the next question from Facebook say, my baby is 2 months and 1 week. I've been doing this. You can't attach a video on this ATP Live. You can't attach a video. So we can't, I don't know what is this your baby is doing. So what you need to do is to describe. There's nothing your baby is doing that you cannot put into words. Just say it in your own words, in simple English. You don't have to use medical jargons. Whatever your baby is doing, your baby is shaking their hands or they're doing their eyes this way, just put it into words. Say which part of the body is affected. Tell us what you can see, how you would describe to any other mother what your baby is doing. It doesn't have to be, you don't have to use medical jargon. So that's what you need to do, and then we can answer your question. If you don't, we can't see videos, we can't see uh photos on live. So there's no way we can only react to comments, words that you write. Okay. You say he shakes his leg suddenly every time. So you'll be shaking the leg suddenly every time. The first thing you need to do is, when does it happen? Does it happen when the child is awake or when the child is sleeping? That's the first thing you need to answer. So some babies do shake their legs when they are sleeping. We call it benign myoclonus, sleep myoclonus. It's nothing, as if they are shocking a little bit, but it's nothing to worry about if it's happening during sleep. So if it's happening during sleep, most time it doesn't last for more than 1 or 2 seconds and it will stop. And it may happen again, but it doesn't usually last long, and usually during sleep. If that is the case, then it's nothing to worry about. But if your child is shaking their legs or their hands when they are awake, not when they are sleeping, in other words, they're jerking or they're shaking their legs and their hands when they are awake, you can try hold the hands or the legs that is shaking. When you hold it, does it stop? When you hold the child's hand or leg, does it stop shaking or it keeps shaking? In other words, does the child have control over it or not? If it keeps shaking, you look at the height of the child. What is the height of the child looking like when the shaking was going on? Is it rolling upward? Is it like the child is not there? then that is the child who is having a convulsion or what we call a seizure. In that case, you need to take that child to the hospital straight away. But if you, when you hold the child's hand, the child stops shaking, or they are happy, they are looking at you, they're smiling, they are awake, they are conscious, they are aware what is going around them, that may just be just an abnormal movement, not that there's anything wrong. So that is how you can decide which one you need to come to see us as pediatricians for, or which one you just need to watch as a parent. Okay, so I hope that is what you're saying. I don't know what you mean by yes exactly, because I was talking so much. So you have to be very careful. You have to tell me what part of my speech is your yes and exactly, so I can't respond to that. Okay, so somebody is saying, is it possible to exclusively breastfeed twins? Yes, it is possible. And if you go on our Facebook group, and you're on our Facebook group, a mother still gave a kind of a testimony. I try to tell our media team to screenshots and like those testimonial of people. So we have a lot of people that have exclusive breastfeed their twins, even though everybody tell them it's impossible. It is not true. It is possible, and you don't have to take my word for it, but you can take the word of other parents who have actually done it. Okay, so what you need is yourself to believe that you can do it. If you believe you can do it, you'll be able to do it. So, but if you surround yourself with people that are even ordinary single babies, some people's their job is to always tell people they can't do things. So yeah, don't follow those pediatricians, so don't follow them. If you surround yourself with those kind of people, then you're not going to be able to do it. But if you surround yourself with people that are positive, if you come to our Facebook group, you get that kind of encouragement. You read the testimony of other parents who have done it, then you can do it, because you produce more than enough breast milk that your baby needs. So, and the more your baby suck, the more the baby suck, the more the milk will be produced. So there's no reason why you cannot breastfeed twins. It's possible. So you can do it by yourself. Of course, you will need help with other things. So you can't be the one also running around for all the house chores, cooking and all that. So most you just have to focus on your breastfeeding, and you can also express, and other people can assist you with feeding the babies with your own express breast milk. But you can easily and perfectly conveniently breastfeed twins if you make up your mind to do it. So it's all about you. All right. Okay. My baby started having diarrhea the same day he started his medication with augmentin, which was prescribed for it. So when you're asking questions, please always start with the age of the child. It's very, very important for us to always know the age of the child. Pediatrician, we see children from the womb, even some that are not yet born. We see them up to 18 years. So we really need to know the age of whichever child you're asking. It's so important. It's just, you must always put it in your mind to always start with the age of your child, because if you are in my clinic and your child is sitting in front of me, I will know, okay, yeah, this is your age of the group of the child I'm dealing with. But remember that I'm not in my clinic now. I'm online. I can't see you and I can't see your child. So you have to tell me the age of your child so that I have a context. So number two, apart from telling us the age of your child, antibiotics always have side effects. And before you give your child any medication, the first thing you need to do is to read. I always marvel when people ask certain questions about certain products they are using and all that, because what that question tells me is that you didn't read before you use the products. And it is a very dangerous thing to do. You must always read the leaflets that come into with every medication before you put it into your child's body. It is very important. Even though as doctors we try our best to tell you what to expect and the side effects and all that, but sometimes, depending on the kind of doctor you're seeing, some may always be in a hurry. They may not have time to really talk to you a lot, but you also have a responsibility as well to read the leaflet that comes with every medication. It is not there for decoration. It is not there. And that is why you are an educated mother that can read. That's why we want our mothers to be educated, because you need to be able to read those kind of things. So if you have read it, you would have known that the augmentin can give you a side effect of loose stools, watery stools, because that is part of the side effect of the medication. But sometimes it's not enough for us to stop the medication, depending on what the medication is being used for. So that is why. So it is not necessary to be asked what is this the side effect of the medication, because all those information should have been read before you start using the medication. So because some children are even allergic to the medication, so you need to know all those. And some medications they interact with the food and other drugs. So there are some drugs you should not give together. This is why it's so important that we read those leaflets. So that's true about augmentin. But that does not mean you should stop the medication. But you didn't tell me the age of your child, you didn't tell me why you're even taking the augmentin, so I cannot comment about that. The only thing I can tell you is that diarrhea or watery stool can happen in a child who is on medication. Somebody say, please, and also my baby suddenly gets scared from sleep and cry uncontrollably. So always start with the age of your child. And if you have asked a question before, please start again, because I cannot see your name. If you don't give StreamYard the permission, I won't see your name. So I won't know which of the Facebook user, because you say, and please also. So I assume that you've asked another question before, but now that you're asking a different question, you have to start again with the age of the child, because all I'm seeing is Facebook user. I'm not seeing your name. So make sure you ask your question completely in one post from the beginning to the end, starting with the age of the child through the end. That's how it will make sense to me. So for those who have asked question, I didn't put the age of your children, you have to start all over again. I'm not sure which one is the 3 months old. Is it the augmenting person, or is it the last person? So again, you have to ask your question again and put everything together in one post. Then it will make sense to me. That is just for ease of answering questions. The next question. Okay, I have a question from Instagram. Please, what can I give my 11-month-old? She has drooling nose. There's nothing like drooling nose. You mean running nose, like I said? Okay, because we use drooling for saliva, not for the nose. So I want to assume it's running nose you want, right? Coughing, sneezing. You don't have to use anything. Most cough, most sneezing, and runny nose are due to viruses. They tend to run their course, they tend to go away by themselves. So the most important thing is keep your child. If your child is feeling cold, you keep them warm, let them drink a lot of water, eat normally. That's it. And then their body will fight the virus and they'll be fine. So you don't need to give any medication for Zolotu, I hope. Yeah, I think that's the only question I can see on Instagram. All right, let's move on for Facebook. 2 months, 1 week old baby. She suddenly gets scared from sleep and cried uncontrollably. That's very unusual for a 2-month-old to get scared in their sleep and cry. When you say cried uncontrollably, what do you mean? If a child said to cry from sleep, I assume that you carry the baby, you try to breastfeed your baby, and you try to pet the baby back again to sleep. So what happens when you do that? Does the baby stop crying? Will your baby start sucking on the breast? And will your baby be okay? If that's the case, we don't call that crying uncontrollably. That is just normal crying. So, but when you use the word crying uncontrollably or inconsolably, which is actually the way we call it, it means your baby is crying, you have given breast milk, you have tried to pet the baby like you would do normally, and your baby cannot be consoled, and your baby keeps crying and crying for minutes and hours, and you can't get that baby to stop crying. That will worry me as a pediatrician. Those are the kind of babies that we want you to bring to the hospital. If your baby is crying, you've checked everything you need to check, and you've made sure the baby is not wet, baby is not hot, the room temperature is fine, nothing has beaten the baby you've given breast milk, you've done all the usual stuff, cuddle the baby, and baby does not stop crying, you have to take that child to the hospital, because that may be a sign of something like an illness going on. Because most babies, don't you do all those things I mentioned, they will stop crying. So you need to be very careful for the choice of your words. No, sorry, I can't answer those questions because I'm not an adult doctor. I'm a child doctor. So I always like to abide by my calling and stay on my lane. So for adult health issues, I'll recommend that you go to the hospital and see your own doctor. You can post on our ATP family Facebook group. So we have our adults doctors there. That's our family physicians and gynecologists, obstetricians. Those they can sometimes chip in, but it's best to see your own doctor so that I won't run into trouble because that's not my. Okay, I thought I saw a question in question section, but I can't see it anymore. Okay, all right. So, I hope I didn't miss anybody's question. Okay. All right. So we still have, we still just roughly got an hour. So if you still have questions, feel free to post your questions and we'll try and answer them as much as we can. Okay, I was talking about breastfeeding week coming up on August. Feel free to get ready for the breastfeeding week. We use it to promote exclusive breastfeeding. Okay, somebody is putting a question in the on Instagram question box. Yukon 99. My baby's poo and gas smell so badly. Okay, normally poo should smell. I don't always know why parents always worry when it smell. It's normal for you to smell, but I don't understand the badly part of it. But it is perfectly normal for babies' poo and farts to smell. There's nothing wrong with that. So I don't know what is the bad part of the smell. I'm really, really struggling to understand what you mean by bad. There's nothing wrong with baby's poo or the fat smelling. So why do you think it's bad? I don't know. So so anyway, for me, that's not something I'm going to worry about. My worry is just keep breastfeeding your baby exclusively, no drug, no nothing else, just breast milk only. So that's all. As long as that's what you're doing, you're not giving any drugs, you're not giving anything else, there's nothing to worry about. And most of your baby's poo or whatever is actually a reflection of what you are eating and passing to them in breast milk as well. So, but there's really nothing wrong. We expect a poo to smell normally, so it's not it's not a problem at all. It's your baby is not pooing or your baby is pooing watery stool or the stools are hard. That is what will worry me about his stool. Definitely not the smell at all. All right, so just relax when you come. There's nothing wrong. Jibab Studio, what causes jaundice? Okay, jaundice in who? In a newborn baby, or in an adult, or in an older child? So you really need to be very specific because when we say jaundice simply just means that the eyes is yellow or the skin is yellow. They hide the skin or what we call the mucous membrane, the lining of the some of the like the mouth and all those places, they look yellow. So that's what it means. So if you're talking about newborn, because since you are saying pregnancy, I want to assume you're talking about newborn. Okay, so it's a newborn, yes. So for newborn jaundice, there are many causes of jaundice. Number one, let's just start by saying jaundice is the most common condition in babies. Every baby, 60% of all newborn babies are going to have jaundice. And if they are preterm babies, it becomes 80%. So if your baby was born before 37 weeks, that is, they are preterm, 80% of them are going to have jaundice. If your baby is born at 37 weeks and above, normal term babies, 60%, 6 out of 10, 3 out of 5 are going to have jaundice. So that tells you how common jaundice is. So, and it's something we all need to know. And there are many things that cause jaundice. So there are two types of jaundice. So there's a jaundice that, because it's so common, it's what we call, it's something that happens in many baby. It's not because baby is sick or anything, just jaundice because babies have too much red blood cells. Because when they are in the womb, because they are basically parasites and thief, and they are just stealing everything from their mother. So they have so many red blood cells so that they can take as much oxygen, as much everything that they need from the mother. So they have so much of red blood cells. That's why when babies are born, they look so red, because they have too much red blood cells. But when they are born, they don't need to steal oxygen and food and things from their mother. They can breathe their own air into their lungs. So they don't need as much of those red blood cells that they have. So they have to break it down. So it is that breakdown of red blood cells that produce what we call bilirubin. Okay. Now, the work of the liver is to clear away those bilirubin. So some babies, they break down those excess red blood cells. The liver is able to clear it out and no problem at all, and they don't have jaundice. But for some babies, because they break down so much red blood cells, the liver itself is still maturing. It's not yet efficient, so it cannot clear it very quickly. So some of those end products of that red blood cell breakdown is what we call bilirubin. That is what you see as the yellowness on the baby's face or skin, or the eyes, the white part of the eyes. So that is what causes jaundice. So some babies have some jaundice, but within a few days, the liver catches up and the jaundice will clear. So most of those babies have what we call physiological jaundice. They will have jaundice, but it is not so much that it will cause problem or damage. See, the important thing for jaundice is that with jaundice, if it's too high, it can get into the brain and can cause brain damage. Okay, cause leading to cerebral palsy, leading to a child who may be deaf, leading to all those kind of complications. So that's what we don't want to happen. The jaundice itself is not our problem. It is the fact that if the jaundice is too high, it gets into the brain and it causes brain damage. And that is what we are all trying to avoid. But so that is physiological jaundice. But some babies have, in addition to the normal physiological process, breaking down excess red blood cells, liver clearing them, so babies actually have medical conditions that can make them to actually break down more red blood cells or cause problem with the liver that it cannot clear away the bilirubin, and that can lead to what we call pathological jaundice, and that jaundice will be so high. For example, if the blood group of the mother and that of the baby is incompatible, what we call ABO, if mother is O and baby is A or B, the antibodies the mother has, they are going to attack the baby's own blood cells and they are going to break it down. So that is going to break more red blood cells down than another baby that have blood group that are compatible with that of the mother. So that kind of baby will have jaundice. Or let's say the mother is red cells negative and baby is red cells positive. So the mother is going to, the antibodies in the mother will attack the red blood cells of the baby and baby will break it down more. Okay, and other conditions like GCPD and all that, or premature babies, they tend to break down the red blood cells more. Or even any problem with the liver. So if there's blockage in the liver or anything in the liver, so those kind of babies, they are going to have more challenges clearing out the jaundice. And what happens is that there's so much jaundice in the blood, it gets into the skin, it gets into the eyes, we can say, and it can also get into the brain. And when it gets into the brain, it can cause damage. So what we normally do is to check for jaundice, make sure we don't miss it, we monitor it, we treat it properly. So if it's a jaundice that is not so high, physiological jaundice, we don't treat it, the child goes home. If it's a jaundice that is moderately high, we put the child under phototherapy lights. If it's a jaundice that is so high that is going to cause brain damage, we have to take the blood and exchange it. So back to your question, I deliberately took time to explain how jaundice happen, because so I can answer your question of how do we prevent it in pregnancy. The truth of the matter is that you cannot prevent any jaundice in pregnancy. You can't, because it is after the baby has been born that the jaundice is going to happen. But there are things you can do. So if you are, for example, rhesus negative, we can give you, and you have had a rhesus positive baby, for your future baby, not the current one, the one that you're going to have next, we will give you Rogam. So the idea of the Rogam is that all those your antibodies that you have been sensitized by your baby, it will clear it out, so that by the time you're pregnant next, those antibodies will be low and they will not attack the next baby if the baby is rhesus positive. So that is what we can do. Otherwise, there's really nothing else you can do about jaundice. Jaundice is something we have to detect early and we have to treat after the baby has been born. So the challenge is some people, you have your baby and you're rushing home, and we live in a country. So for this in Nigeria, in UK, for example, the midwives go to the house, they'll come check your baby for jaundice and all that. So, but in Nigeria, we don't have health visitors or midwives that come to the house. So that's why some of us don't like you going home too early. We want you to be in the hospital for the first 3 days so that we can check the baby for jaundice. And well, I hope that you will be sensible to pick it up and come. But first time mothers don't usually notice jaundice. They will think the baby is just fair. So sometimes it's better to stay in the hospital because most babies that will have severe jaundice, they would have had it by the 3rd day of life. They will have had it. So it's very unlikely for severe jaundice to start happening after you've gone home on the 3. So that's why we want to keep you with us. But if you have gone home early, please check your baby. And if you think your baby's eyes is looking yellow, please don't go and give pawpaw water. Don't go and give ampiclox. Ampiclox is not the treatment for jaundice. Glucose water is not the treatment for jaundice. Pawpaw water is not the treatment for jaundice. Not wearing yellow clothes is not the treatment for. It's not the cause of jaundice. Or wearing yellow clothes is not the cause of jaundice. I've already told you what causes jaundice in babies. Jaundice is an emergency. Don't say, oh, we wait and do naming ceremony and then go and do jaundice test later. I see all the babies that have the brain damage because that's my job. So, and all the time I always ask, why didn't you go to the hospital? And the mother was like, oh, we were doing naming ceremony. We will say, or we'll go after. Please, if your child has any health issues, go to the hospital. Stop. Somebody was telling me the other day on our Facebook group that she's a pregnant woman and she's having abdominal pain, and she said that, oh, I can't go to the hospital now because it's raining. And I'm like, what? I was like, that's the most silly excuse I've had of not going to a hospital. You are practically having a miscarriage and you don't want to go to hospital because it's raining. Raining because of what? Why can't you call an Uber? Why can't you call, a car will carry you in the rain to the hospital. Like, seriously, rain. You're going to walk to the hospital. You're going to go in a car anyway. So please, let's stop giving her these excuses for not seeking prompt healthcare, because some people will eventually go to the hospital, and if you don't come on time as well, the jaundice will always clear. I always tell mothers the problem is not the jaundice clearing. Jaundice will go whether we treat it or not. Eventually the liver will clear it. But the problem is, by the time it's gone, what damage are still left behind for us to be dealing with? So by the time it's gone, sometimes it has caused brain damage. So, and I see those posts again on my Facebook group. So sometimes just reading through the Facebook group, I see all these things because I either see them in the clinic or I see them on Facebook group. So, but like, oh, my baby had exchange blood transfusion now. My baby cannot carry the neck at 8 months. My baby cannot sit. Complications of jaundice. And that's what we have to deal with and deal with maybe for the rest of the child's life. So we don't want people, and some of you that go to those hospitals where they will take blood and they will tell you to come back in 1 week. Lagos State hospitals, they need to do better. Please, if you go to the hospital and they take blood for jaundice, you must get that result that day. You should not go home. You sit down there and tell them, I'll have to wait and get this result. It is not, I'll go home and come back. Jaundice, you need to get that result same day, same hour, if possible, because that will determine whether we're going to keep you in the hospital or we're going to send you home. So don't take blood and I'll go back 3 days later. That should not be happening. Tell them I will have to wait for my result. There's no blood test like jaundice, PCV, malaria that cannot be done the same day. All those tests can add the same day test. They are not like blood culture or something that you have to go and come back. You must wait and collect your results so that the doctors can do the needful. So I think if you want to know more about jaundice, please go to our website. You can read my article on jaundice there as well. All right. I've answered this question about 2 weeks old baby. If your baby is crying uncontrollably, you have to take the baby to the hospital. Okay, I think I've answered this one. Um, I'm not sure I understand this your question. A 2 weeks, 2 months old baby is as if something wants to take her away. What is take you are? I think you're projecting your thoughts or your fears into your baby's symptoms. You don't have to do that. Not, I mean, you are having your baby with you. What is taking your baby away? Is there another force or power there that is going to take baby away? There's nothing like that. So if you think your baby is having convulsions, take that child to the hospital and let the doctor deal with it. But all this, something is taking baby away, baby is crying unconsolably. I'm not really sure where we are going with it, but I really think that child needs to see a pediatrician. Please, if doctor prescribed for a baby and is still on breast milk, is the child still on exclusive? Yes. So if your child is on exclusive breastfeeding, only a pediatrician, a doctor can prescribe drugs. And of course, we're not going to prescribe the drugs for 6 months. We're only going to prescribe drugs for 3 days, 5 days, 1 week, max 2 weeks. So that does not stop your baby being on exclusive breastfeeding. When we talk about exclusive breastfeeding, we're talking about you giving drugs that we have not prescribed, okay? Or giving formula or giving water. That is not exclusive. So what it means that if exclusive breastfed baby is sick, we have to choose treat the baby. So we'll give drugs. So that's not a problem. 2 years, 3 months old talks well, makes sentences, but does not seem to understand difference between yes or no. Uses more of yes for every questions and only uses no when he's angry. That child is not talking well. That child is not understanding. So when we talk about speech, parents look at what the child is saying. We look at what we call understanding, what we call receptive language. And then what the child is saying is what we call expressive language. Both of them are parents are most concerned about expressive. What can the child say? Most of the time, we are more interested in not just the expressive, but the receptive understanding of that child. So if your child does not seem to understand when to say yes or no, then that child's understanding is worrisome. And then it also depends on what language you're using. A 2-year-old, you cannot be speaking to them like I'm talking now. I'm talking now like I'm talking to an adult. So if I want to talk to a 2-year-old, you have to bring your language to simple, not more than 2-3 words sentence. Don't speak long grammar for a 2-year-old. Just ask them, do you want biscuits or apple? That's all. And the child should say either apple or biscuits, not like yes or no. Avoid putting them into the yes or no kind of scenario. Let them learn to use words to say what they want. Rather, you can give them choices and all that. So um because see, you are the one making your own assessment. You are the one telling us your 2-year-old is talking well, is speaking sentences. You've not told us what the child is saying, and so we cannot say whether you're right or wrong. And sometimes parents are too close to the situation to see what other people are saying. So sometimes we have to do our own assessment. But my whole rule of the thumb is, if you ever worry about your child talking or speaking or understanding, I would rather you go to a specialist, a professional, a speech therapist. Let them see the child for you. Even if at the end of the day, the speech therapist was going to tell you that there's nothing wrong and all is well, then you will sleep better at night. You'll be more relaxed than for you to be thinking, maybe there's something is not wrong and there's something actually wrong. So that you don't lose anything going to see, have a professional opinion. It's better to have a professional opinion than your own opinion, and let the professional be the one to say this child is talking as we expect for a 2-year-old. And if you're on our Facebook group, we have a guide session, I think it's guide 9, about the milestones for speech for a 2-year-old, including the receptive and the expressive. So, and then there are also like, when do you go to the hospital? When do you see a speech therapist? So I would rather you just check it up there and follow the advice. All right. Someone said 2 months old baby has stalk bite at the back of her head. When I touch it, the color gets back to normal. Well, will it clear? Stock bites will clear. It will eventually clear. You don't need to be touching it and doing. Just leave it alone. It's a birthmark, okay? It's just blood vessels that are there. They are all going to clear. It may take days, weeks, months, but it will clear. You don't need to do anything. Just leave it alone. Don't start bothering yourself. My baby has been coughing. How old is your baby? Always start with the age of your baby and how long has the baby been coughing for. That will tell me what to tell you to do. Can a baby start showing teething symptoms? How old is the baby? Because when you ask question, you don't put age. It's just so hard to answer the question. Because you say, can a baby start showing symptoms? Who is a baby? Because even the 2-year-old that already has all the teeth, people still call them babies. So you have to put age in all the questions so that it makes sense to us, so that we can give you the right answer. Okay, I think Instagram. I don't see any question on Instagram still. Okay, I think I've answered this one already. Okay. My time is up now. We have 4 minutes. Okay, so we're almost done. So if you still have questions and we've not answered your question, feel free to post the questions directly to our Facebook group. I want to crave your indulgence when you post on our Facebook group to give us time to answer your questions, because everybody on our group is a volunteer. So it means we can only answer your question in the spare time and everybody's going to work. So some questions are like, what I call like pure water kind of question. People have asked it, or even most people can answer the questions. So usually our moderators are the ones that will answer those kind of questions. But some questions are complex and more specific, you will need a professional to answer it. So if you ask those kind of questions, you put a picture, a video, a pediatrician has to review those ones, and these ones may take a little bit more time. So we usually say you give us up to 72 hours before you say, oh, I want to post my questions again. Don't post it twice. It will just make the workload look a bit bigger than it actually should be. Just leave it once, wait for 72 hours, and then we'll answer. Most time we do it before 72 hours, but just maximum limit 72 hours. If you have an emergency, please don't post. What is an emergency? In a simple word, an emergency is you need an answer now, or you're afraid the child will die if you don't get an intervention now. That is the definition of an emergency. Something that is a life or death scenario. Don't post those on Facebook, okay? I believe we are all sensible parents. You can, for those things, you have to go to the hospital. There's really no point. Your child is convulsing, go to the hospital. Okay, your child has fallen and is bleeding, you have to go to the hospital. Your child has sustained burns, you have to go to the hospital. Your child is not breathing well, you have to go to the hospital. There's nothing we can do in that scenario. Your child is vomiting, you have to go to the hospital. But if you want to know, oh, how do I feed my baby? How many times should I feed? Hey, those kind of questions, it's not a life and death. So you can get the answer in 2 days and your baby will still be fine, because it's just about how do I do this? What do I do? How do I? Those are the kind of things we are wired to do on a Facebook or social media. But any child who is in a health crisis, who is really ill, who is needing like intervention, there's really no point to post on our group. If it cannot wait, it means it has to go to the hospital. That's what it means. Anything that cannot wait, you have to go to the hospital. And the earlier, the better. Don't put it on our group and say it's urgent, it's an emergency. If it's urgent, it's an emergency, you should not post it on our group. You should take it to the hospital. One of the things we need to improve on is how often we seek, how quickly we seek the right care, because all of us are also in the hospital. So you come and meet us there. So it's best to come and meet us there. All right. 2 months old is the one coughing since yesterday. So if your baby is a 2 months old and just coughing, just watch for now. Make sure you're breastfeeding exclusively. Make sure there's no body who is coughing around the baby. We don't want baby to be exposed to people who are coughing, who have cold, who have catarrh. So just watch. Most of those are viruses and they will go by themselves. But if your child is having fever with a cough or breathing with so much difficulties, you have to go to the hospital. I was very unhappy when the mother posted a picture of her son who was really, really in severe respiratory distress. And she was like, oh, well, should I take this? I'm like, you can see that your child is. So when people read our answers, sometimes they always leave out the what we call the safety net. In other words, when we tell you watch, we always also tell you when to ask. So I will never tell you your child is coughing, just watch for now. I don't hang my answers there. And most of you can always go back and read all the answers. I always tell you what to do next if things are not better, because I can't just tell you your child is coughing because it's just one day. I will say watch, but I'm not going to stop it there. I always tell you what there's to be watching out for. And if those things start to happen, you have to take the child to the hospital. So if your child is not having fever with the cough, very high fever, especially, child is having difficulty with breathing, or the child is breathing very fast, noisily, that child has to go to the hospital. So always make sure you don't read the first part of the answers. You read everything, because we always tell you, like, if your child is having diarrhea, we tell you give ORS, give oral zinc. But we also always tell you, if the child is now vomiting the ORS, the child is still very thirsty, or the child cannot drink and all that, or there's now blood in the stool, you have to go to the hospital. So for every time a doctor tells you to watch, we also tell you the second part of it, which is, when do I now stop watching and go to the hospital? So don't just take, oh, okay, the doctor has said I should just watch his virus, or his no, please remember the other part. I notice that many people don't remember the other part. Remember the other part of, when do I now go to the hospital? It is so important, because that is very that can be dangerous. So for the 2 months old coughing, please keep breastfeeding, keep warm, don't expose to people with cold, fumes, don't take to the kitchen, nobody should be smoking in the house, nobody should be avoid sprays and stuff, anything that will irritate the child, that will make the child cough. There's no reason a 2 month old should be coughing. Somebody else is giving that child a cough. So you have to deal with all those. And if the child is sick, coughing, with fever, with fast breathing, with difficulty with breathing, you have to go to the hospital. What is breast milk jaundice? Jaundice can be caused by breast milk as well. But there are some things in breast milk that can make a child also have jaundice as one of the causes of jaundice. But those are the more like the what we call exception, like the we exclude, at the end. If a child has jaundice, we're not thinking first breast milk jaundice. Breast milk jaundice is not the number one. So we are thinking of all those other things, blood group, and we have to do all the blood groups, do all the check for infection, sepsis, check for GCSPD. Is it a premature baby? We check for common things first. But if we have done all that and we can't find a cause, sometimes, and we're thinking, especially if the jaundice is longer than 2 weeks, usually breast milk jaundice tends to give what we call prolonged jaundice. Then that's when we start thinking of things like breast milk jaundice. And what we normally do is to just stop breastfeeding for 24 hours and it will crash. Then we know it's breast milk jaundice. But that does not mean you should stop breastfeeding. We'll continue to breastfeed, because breast milk jaundice does not cause brain damage. So that's just that. You see, I must hold my breast to breastfeed. So there are different breastfeeding positions. So depending on which position you're using. So there's a complete video on positioning your baby for breastfeeding. I'll recommend that you watch it. So you must know which position you're doing and how to do it. Breastfeeding is a skill that you have to learn. It does not come natural, and that's why we have breastfeeding consultants of our nurses, midwife, pediatricians. We support you to breastfeed. So come in August, first week of August, we explore that the more. The reason why it is best some of you hold your breast is because if you are not careful, your breast can fall and block the nose of the baby. So breastfeeding is an active procedure, especially when your baby is still very small. So usually by the time maybe about 3-4 months, they are holding the breast by themselves. But for the newborns, you have to hold it, you have to be careful, you have to monitor them. You can't be breastfeeding and be pressing your phone and be looking everywhere. Please, you have to be looking at the baby before you put the breast in the nose, or before you allow the breast milk to block the nose. And babies breathe through their nose. So if their noses are blocked, the baby can die from that. It's as simple as that. They are that very dependent on oxygen from their nose. So we don't want, things like that to happen. So please, if you are not holding your breast and your breast is not blocking the nose, it's okay now, but make sure at least you're doing the right thing. You are checking on the baby and you're not just putting the breast and your mind else, you're doing something else. Just very careful. So I just need to put that caveat there. 2 months old, that cough, I think I've answered that question. It is not teething. Everything is not teething. Stop assuming teething for every little thing. It's not teething. Teething does not cause cough. Teething does not cause fever. Teething is just a child bringing out teeth. It does not make the child to have any illness or anything. Please don't you ever assume teething whenever your child has any symptoms. It's a very dangerous thing to do, and mothers do that a lot, especially in Nigeria. Any little thing, child is having diarrhea, he's sitting, child is having fever, he's sitting, child is having cough, he's sitting. No, teething does not cause any of those symptoms at all. So stop making those assumptions. If your child is coughing, it is cough. What is causing the cough? Is it an infection? Is it pneumonia? That's what you should be after. Don't even be thinking of teething at all. Your child is having diarrhea, is gastroenteritis, child, give ORS. Don't be thinking, oh, maybe it's teething. It's not. It's never teething. So just even remove that teething out of your list of differential diagnosis. Okay, this always happens every time. Whenever I want to go, people will start dropping all the questions. I think I've answered the question about breastfeeding. It's 4.5 kg okay for a new 2 months old? That's okay, depending on what is the birth weight. You didn't tell us the birth weight of your baby. If your baby was 4 kilos at birth and it's now 4.5 at 2 months, that is not okay. So you always see the context of question is very important. So you always have to tell us, this is my baby's birth weight. Maybe it's 2 months and it's now weighing this. Then it's easier for me to say, yes, I can see that baby has gained 2 kilos in 2 months. Then I'm happy with that. But now I don't know if your baby was 4 kilos at birth. But anyway, I hope your baby has gained weight, which is fine. Please, my baby woke up with a red spot, one on the eye. She's not itching. Should I be worried? No, just watch for now. But what happens to the eyes? Because the red spot don't suddenly just appear in the eyes, especially for a child who is not having watery eyes or itching eyes, which means that is an injury may have happened to the eyes. But unless the blood has been there right from the beginning, you didn't also tell us the age of your baby. Always start with the age of your baby. I'm going to pass on. All right. Always start with the age of your baby. It's so important to the pediatrician. Most people just like, mothers like to say, my baby, my baby, my baby. We need to know the age of this baby. That's what makes sense to us. Anyway, but just watch. But if the redness keep increasing, then you can go see a doctor. Or if your child is itching, or if there's high discharge and all that, you can now see a doctor. Okay, I think I've answered all the questions. One last person on Instagram. My baby is 20 kilo for a 4-year-old. A 4-year-old should be weighing averagely 16 kilos. So 20 is a little bit on the high side. It's actually overweight. Let's put it that correctly. So, but it's not like the kind of overweight that I'm going to start worrying, running blood tests. I'll just say, watch what your baby is eating. Take out all the junks, all the pastries, all the biscuits, all those stuff. Take it out. Give fruits, veggies, healthy meals. Don't overfeed your baby. Let them be active, playing, not just sitting down watching the computer or playing games all the time. Let them run around. Let them go out. Let them do physical activities, and then just keep an eye on it. Most time that's what the baby would do, and it will be fine. But if it keeps increasing, despite doing the right thing, eating healthy and all that, then you have to see a pediatrician just to make sure it's not something medical, because there are medical conditions that can make your child to be overweight, and we may need to deal with that as well. All right. Thank you, everyone. I think I need to go now. Okay, the baby with the high something is almost 2 years old. So you really need to know what happened, because a 2-year-old can injure their eyes, or somebody can injure their eyes. Something must have happened for that redness to happen. So just watch and ask questions. What really happened? You'll be surprised what you find out. But most time, if it's just a minor thing, it will just go by itself. But if it's increasing, you have to go to the hospital. All right. Thank you, everyone, and have a wonderful, wonderful evening. Like I said, if you still have questions, feel free to post your questions on our Facebook group. We will try and answer them within 24 to 48 hours. Maximum 72 hours would have done that. I don't know what it is. So August, we're going to have our breastfeeding week. Next week is our ATP week, because our 8th anniversary, and we've been doing this. So it's just going to be a fun time on ATP, but we'll see how it goes. Thank you so much for watching, and have a wonderful, wonderful evening. Bye, 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 bye.